Hello and welcome to Literacy Now, the show where you will learn how to find and access the best resources for a topic quickly. My name is Nancy Messina, and today's topic is health literacy. So you might be wondering, what exactly is health literacy? That is an excellent question. Health literacy is often defined as the ability to access, understand, evaluate, and use information about our health. We chose this topic because health affects everyone, and the more you know about this topic, the better your health care outcomes often are throughout your life. When looking at the statistics from the 2003 National Assessment of Adult Literacy, which had a component specifically designed to look at a person's health literacy, one sees that a very small percentage of adults, only 12%, are considered proficient in health literacy. 14% actually fell into the below basic level. When broken down by age group, the levels of literacy varied, though most people still fell into the intermediate category. No one age group outperformed the others, as at least 28% of each group fell within the below basic or basic literacy level. We are hoping that through this show you will be able to increase your health literacy, which will hopefully lead to better healthcare outcomes in your life. When we come back, I will be joined by Lindenwood University's Director of the Institutional Review Board and Research Ethicist to learn about why health literacy is important and about some of the resources that he has used to become more health literate.
I'm a retired school psychologist, and helping people was my thing.
I was very independent, thought I could take care of myself. I fell and I had to have Meals on Wheels.
After my stroke, when Meals on Wheels started, I was on the other end of the stick, so to speak.
Meals on Wheels coming to my door as someone who's housebound, having someone check on me, assures me that I'm not forgotten.
Meals on Wheels has given me a mode of freedom that I wouldn't have otherwise.
We're the clients.
We are the clients.
We are the clients of Meals on Wheels.
America, let's do lunch.
1 in 6 seniors faces the threat of hunger, and millions more live in isolation. Drop off a hot meal and say a quick hello. Volunteer by donating your lunch break at americaletsdolunch.org.
Welcome back. I'm now joined by Lindenwood University's Michael Leary. Hello and welcome, Michael.
Hi, thanks for having me.
I'm glad you are here. So could you tell us a little bit about yourself and your background with health literacy?
Yes, I come to health literacy by a fairly non-traditional route. I'm the director of the Institutional Review Board here at Lindenwood University. And an Institutional Review Board is a federally mandated group of people at a university like ours that is charged with reviewing a study that involves human subjects, if it's performed by the faculty or students here at Lindenwood. So if a faculty member has an idea where they want to perform some sort of experiment or research study that involves a person, it comes through the Institutional Review Board. And there's a lot of laws and regulations and ethics that go into that process. And as part of that process, one of the things that we're vested in is ensuring that participants in a research study know what's happening, and that the researcher, the study team is communicating to them effectively what they're going to be doing and what the risks might be, and that what they're doing is entirely voluntary, and they could use consent forms to do that, or it can happen in a conversation. But a lot of what an IRB does has to do with finding ways to communicate somewhat difficult scientific or biomedical or health concepts to people well. So that's one reason health literacy and its principles are really important to what I do. Okay. But also I work as an advisor with a lot of researchers in different environments, and biomedical research and behavioral research, and the way that we do science is changing quite a bit. One of the big changes that's happening in a lot of research right now is that scientists are beginning to think more in community-oriented terms, where the way things used to work is you have the scientist in the lab coat and they have a great idea, and they're going to perform their experiment. It might involve people in the community. They may or may not know what's happening, but that's kind of how science has advanced in the past. Now people are more interested in thinking collaboratively between the laboratory or the hospital and a local community. So a researcher might work with advisors from a community, or they might become more familiar with the community so they can communicate better and interact more effectively with research participants or people that are coming in for healthcare. Because people bring all kinds of different backgrounds and stories and histories into any healthcare or research interaction. And an effective researcher or an effective physician or nurse is going to know those stories and know those features of somebody's background, and they're going to be able to communicate well with those. So I come by a fairly non-traditional route, but these principles that we learn in health literacy, many of us are finding that they're far more important than we thought they were, and they're applicable beyond just the one-to-one interaction that you have with a nurse or an ER doctor or something like that.
All right. Well, that's a very interesting way to come into this. So, awesome. Well, in the first part of our show, I talked about some of the statistics regarding health literacy. How does having low health literacy affect a person's life?
Yeah, the stunning thing about the research here is that there's a very clear connection between low health literacy and poor outcomes, not just in a short term, but in the long term over the course of someone's life. So we know that low health literacy leads to a much lower quality of life. And it leads to poor experiences in terms of mental health and in terms of family stability and all the things that are kind of associated with healthcare. Anything that happens in a healthcare situation, we tend to think of healthcare as something that's kind of, I have a headache, I'm going to take an aspirin, or something worse has happened to me, I'm going to go to the doctor. And then we're done with that healthcare experience, let's call it. When in reality, our health is intimately connected to who we are and the way our lives work and the kind of successes we experience in life. So healthcare literacy is really tied to the ability for someone to flourish in society.
Wow. That's really, I don't think I had thought of it quite that way. So that's a really nice way to put that. That's very cool. So, so I know that we've probably all had some kind of maybe negative experience with healthcare because it's a complicated topic. So how could health literacy have helped make those experiences better?
Well, this is a big question. Let's just start. We've all had the WebMD experience, right? Where you have a stomach ache, you get online, and 5 minutes later it turns out that you have bowel cancer. That's a common experience. I think all of us have been through that. And it's a way for us, I think, to understand that there is a lot of stress and anxiety around healthcare. And it's clear, we also very clearly know that our mental health is also tied to our experience of healthcare and what we think of our bodies, how they're functioning, or whether they're functioning well or not. So health literacy can go a long way toward removing a lot of the anxiety and stress that we feel as people about our bodies and about what's happening to us. And because of that anxiety, there are some people that are very proactive about their healthcare, so they might think that something's going wrong, and they begin Googling, they begin looking, and they try all sorts of different types of treatments or cures for something that they're experiencing, and a lot of those probably won't work, which only just increases the anxiety around what they might be feeling or experiencing. So really, health literacy at base is about being empowered to understand what's happening to me and communicate with a professional or someone within the healthcare system about what's happening, and then connect with better treatment and care for that. So you might have, like everyone else, have had very stressful experiences with the healthcare system. And it's not just about, I feel sick, I feel anxious, then I go into some kind of healthcare environment that I don't understand, so I feel even more anxious and stressed out. But the healthcare system is extremely difficult to navigate financially, in terms of time, even just finding ways to establish, setting up appointments, that kind of thing, reading the paperwork that gets slid across the desk to you every time you walk into the hospital. There's a lot of those other practical bits that come into this as well. We can even quantify the drain low health literacy puts on the healthcare system. because of that anxiety. Someone might wait longer than they should have to go get help because they're not aware of really what's happening with themselves.
Right.
Or people might, because of their health literacy, pursue other courses of treatment or multiple visits to the same healthcare system for one thing.
Right.
There's all these ways that low health literacy contributes to this really bloated healthcare system that we have.
Okay. Yeah, I think probably every one of us knows someone that you have your trusted doctor, so you want to go
Right.
to them.
Yeah.
So I totally understand what you're saying.
And a lot of people don't even have it. It's actually kind of a privilege to have a trusted doctor. A lot of people don't have that. I've spent many years of my life not having a doctor where I felt that I had some sort of connection with, right, or that I could trust. I do now, and it's a much different experience, isn't it?
Right.
People with in a lower income situation, or people that are moving, for example, to a new area, they don't have that. What they're going to do is really go to the easiest place they can to get health care and kind of take what they can get. So it's a bit of a privilege to have that trust, that feel of trust. And one thing that healthcare literacy can do for you is that if you're in a situation where you don't feel that connection or a sense of trust, health literacy will empower you to make good decisions and to not feel as anxious as you might in that circumstance.
Awesome. Good. I think that's what we all want.
Right.
We want that empowerment. Okay, so with that being said, how do you recognize accurate sources of healthcare information?
Yeah, this is such a crucial question. So health literacy is kind of like the trunk of a really big tree with a lot of branches. And there's a lot of different forms of literacy that come off of this trunk. There is health research literacy, being able to read current research and understand if it applies to you or if it's effective, to be able to read healthcare literature and understand if it applies to you and maybe perhaps how you can utilize it. There's what we call data literacy, which is our capacity to use and apply data that we're seeing, whether it's in a chart or whether it's presented in percentages and means and averages. There's all kinds of different forms of literacy that are part of this. And there's research literacy as well, knowing what it means to participate in research and even if you are participating in research or not. But really pertinent to that question is data literacy. So we just went through a pretty intense presidential election cycle, right?
Yes.
And afterward, it came out that there were a lot of different types of news agencies that actually weren't news agencies at all. They were just really fronts for people that are very savvy at making money through sharing information online through different social media platforms. And there's been a lot of talk around that, about how people were very influenced by some of these, obviously, whether they're fraudulent or disingenuous news sources. And of course, that's a pretty political question in our environment right now. But it's a good example of the fact that we have a data literacy problem in the U.S. and that people have a difficult time determining whether something they're reading is accurate or not, right? And obviously that's crucial in healthcare, because we read every day in our social media feeds and through the ads that pop up online when we're browsing. We read about this treatment's going to fix this, right? Or taking this natural medicine is going to help this. How do you know what of those are accurate and which are not? Which is a financial question, because we could spend a lot of money going down the wrong path. It increases anxiety. Maybe I'm not doing something I should. So the data literacy problem, how do we solve that? Well, I think there's a few ways that we need to think. The first is that we need to be better at identifying the source that's providing the information. So obviously, our major newspapers, our major news outlets, our standard trusted places, even if maybe we have a difference in political affiliation from one of these resources, all of our major news outlets have science and health sections with journalists that run those beats that come often from biomedical backgrounds, sometimes they don't. But it's not hard to find accurate information about current research and current options on the healthcare market for a condition you might have. For example, New York Times, Washington Post, St. Louis Post-Dispatch. We know where our trusted resources are. When you're reading something and you don't recognize the URL, or there's no About Us link, where you can click it and see that, all right, well, here's some, physicians that work here, or, you can't tell where it's coming from, it's probably not trustworthy, because the way information propagates on the internet, there's no control for that. So also think in terms of peer review. One of the first things I do, if I'm looking at an article where it says, oh, we've discovered something great that you should consider in your healthcare, is I look for it to be backed by peer-reviewed research, which means that some researcher or group of researchers spent a long time collecting data on this question, and they published it in a journal, and that journal article was reviewed by a few other, or even in some cases many other researchers before it was published, so that there's a consensus among experts in that field that, you know what, this is right, or it's most probably right. That's kind of the golden standard if you're looking through your newsfeed and wondering what's correct or not. Another good place to go is if you have a specific condition or you want to become involved in a certain field of research, there is a nonprofit associated with pretty much anything that you can imagine. A group of people that have gotten into developing that nonprofit or community around a condition because they've experienced it, or they have children that have experienced it. And they've done this because they want to help other people navigate that same condition or become involved in the same kind of research. Those kinds of nonprofits tend to be really good sources of information. So different types of heart disease or different cancers, it's pretty easy to find a nonprofit with a web presence that will have information about accurate, usually up-to-date information, peer-reviewed information about the features of the condition and the range of treatments that physicians are currently using. So we have to think in healthcare a bit more fundamentally about our own personal data literacy and what filters we're using to decide whether something we're hearing is true or not.
No, I think that's very legitimate. A lot of, I think, evaluating our what's coming in, it's really very important. So so we kind of covered this because there is a lot of different healthcare topics that are out there. I mean, there's always a new healthcare study, something going on, and they come across in a lot of different ways. How does being health literate help people understand that research a little bit better, like the actual research articles? I mean, most of us aren't health researchers. We're just the everyday person. So is there a way that being health literate will help us with that?
I would hope so. The problem is that science advances at a fairly rapid pace. And usually what gets coverage in the newspapers are two things. Really pretty big discoveries that have proven to work, like right now we've figured something out about a certain cancer, or we've found a treatment for the Zika virus, things like that. Or also what you'll see a lot in the news is global health crises. People experiencing this, Ebola, for example. Newspapers love that stuff. And it's important for us to cover and understand those stories, which we can talk about a little bit if you want. But what was the question?
No, it was just that how, with all these research studies, how do
the research on the research angle.
The research angle, because it's all it's so scientific.
It is.
So for the normal person,
when I began my career in research ethics and working with scientists to develop better protocols and implement their research, I had to spend a lot of time learning different types, different terms, different concepts. So from someone that's not from a biomedical background or doesn't have a degree in biology or chemistry or something like that, it can feel a bit daunting. Even articles that are written at a popular level in the New York Times or Washington Post, places like that, a lot of times those will have terms and concepts that even for the average reader they're going to wonder what is that. Well, Google is your friend, honestly. That information's a double-edged sword. There's so much information out there, it can be difficult to ascertain which healthcare information is good for me and which is probably not. But on the other hand, there is so much information out there that it's fairly easy to work through something you're not understanding, such as, let's say, something on next generation genomic sequencing in the New York Times.
Okay.
That's really at the cutting edge of science right now, or the Precision Medicine Initiative that has begun in the past few years. These are, kind of fairly complicated research concepts and complicated systems that are occurring within our, within the U.S. right now. But you'll have to do a little digging. And that's part of health literacy, is that no one's really going to hand accurate health information to you on a platter to say this is everything that you're going to need to know for your entire life about healthcare. That you actually are going to have to learn something. Mm-hmm. And a lot of us only do that when maybe it's too late, that we get a diagnosis, right? And then we begin to learn quite a bit about different body systems or the environmental factors that led to us having that condition. What if we had done that learning a decade ago?
Exactly.
Yeah.
No, I think that really flows with, I think, the idea of literacy, the different ideas of literacy in general, is that you do have to put a little bit more effort up front,
right,
for you to actually gain a lot out of it. So that's good to know. That
yes, and you got to ask questions of your healthcare providers. Most of us we're bred to go sit. And we sit in a waiting room, we fill out our forms, and then we go into another little room where we fill out more forms and we wait, and then someone comes and asks us questions and we dutifully answer those questions, and then we try to explain what we're feeling as best we can, and then a bunch of stuff happens with needles or different instruments, and we don't know what's going on. What we're thinking, though, is that I trust these people and I'm just going to go along with what they're doing because I want to get better.
Right.
When in reality, it's at that point of care, it's okay to ask questions, and it's really important to. And good physicians, there are advocates of the healthcare system. They work within the healthcare system, and you will encounter them, and they will help you understand what's going on. So I do spend a lot of time asking questions now, far more than I used to. Even if I feel like it's a dumb question, I'm going to ask it because there's no one else in the room, so I don't have to worry about feeling dumb. And doctors, they actually do typically like those questions.
Okay.
And they'll be able to answer those. But we are also talking about research here with this question, like you started. And health literacy is really important right now because there's been a pretty dramatic convergence of research and treatment. So back in the day, I'm talking up until the mid-1970s in the United States, we didn't have any regulations or ethics that distinguished neatly enough between research and healthcare. So you could go to your doctor and you will receive a treatment from your doctor, and you might have actually been part of a research study without even knowing it. That's not possible now. The regulations are set up, and we have institutional review boards set up so that any time that you're part of a research study, you're aware of that, and you're aware of the distinction between research and healthcare. But part of health literacy is knowing the value of research for you personally and for society generally, so that when you're participating in the healthcare system, that you're aware that also as you're being treated, we're generating data that will help people in the future. And your activity, your participation in the healthcare system is actively, hopefully, providing physicians and researchers and scientists the kinds of experiences and data that they need to make things better for our children and for people with different conditions. So a lot of people, they get into a healthcare situation and the person with the white coat comes in and they have this giant consent form and they've just found out that they have cancer, right? Or they just found out that they have a different diagnosis. It could be anything. And they're still processing that. And now here's somebody sliding a 30-page consent form across the table to them saying, well, we want you to also be a part of this research study at the same time. And we need to be prepared for that.
Okay.
It's really important for us because that's how science advances. It uses raw human capital, to put it bluntly.
Sure.
People with different conditions and experiences that are willing to actually participate in research at the same time that they're getting health care. But that can be so daunting and so confusing. It's important to really be aware of what's happening, what research means, how research works, and how it might be intersecting with your life right now.
Okay. Very cool. That's good. And I did not realize that before there were no restrictions on the study. So that's, I'm so glad
history.
we have that.
Yeah.
Okay. So thinking of that as well, how could health literacy be considered a civil rights issue?
Oh yeah, that's such a good segue. Health literacy is a civil rights issue because healthcare and civil rights are intimately connected. And I think we're seeing that pretty clearly. We see that in the St. Louis area very clearly. We have in the past 10 years or so as well, where we have a lot of data now in the St. Louis area even about how healthcare access has affected certain areas of the city, and we can see very clearly where our lowest health literacy rates are relative to other areas of the city. And health literacy rates are very connected to economic opportunity and educational opportunity. So we're kind of in a situation where health literacy is connected to your education access and your economic access as well, which means that low health literacy tends to be connected with racial minorities. It tends to be connected with the elderly. If you work through the National Assessment of Adult Literacy, you'll see very clearly that adults over the age of 65 have extremely low rates of health literacy. Because they don't have access to the same kinds of education that younger people do. They don't have the same facility with online resources that younger people do. So racially, in terms of age, in terms of education and economic access, health literacy is symptomatic of all of those things. And that's important for us to recognize because as we started talking about, health literacy is directly connected with our capacity to flourish.
Right.
We can't really state it more bluntly than that. That health literacy should be something that we're thinking about in terms of a very important civics issue for the St. Louis metropolitan area.
Awesome. No, and I think everything you've said has really made that case that it really it does matter. It does change your life.
And we're also becoming a really more diverse society too, aren't we? With the expression of a lot of different religious points of view and different spiritualities and different types of biographies are now part of the American experience. And as I mentioned earlier, people bring those biographies to every healthcare interaction. And there's been a lot of interesting journalism on the fact that physicians sometimes don't get where people are coming from. So they'll give people treatments that they might have a fundamental problem with in terms of their religious heritage. Or they might receive a certain medication or prescription that conflicts with their personal code of ethics or some part of their personal background. And health literacy and the way that we teach health literacy in medical school and in nursing education, those types of environments, is really catching up with that and doing a good job of diversifying the way that we share and communicate health information. So that's also somewhat connected to that civil rights question.
Right. No, and I completely agree. Like I think that kind of flows into the idea that that it is health literacy is global and it spans a lot of different cultures as well, and all of those different pieces. So I think you have to take all of those things into consideration.
Right.
So I wanted to thank you so much for coming and talking with us today. I am Nancy Messina, your host for Literacy Now, and I hope to see you next time.